right, it's 3 o'clock.
Okay, I'd like to call the Board of Health meeting to order. We have a quorum. We have all the members here, and we have some members, some people from the public. And I would like to, first of all, acknowledge that Jim has got his finger up. What can I do for you?
All right, let me just open up the meeting real quick. So May 26, 2021, 3 p.m. This is the Stockbridge Board of Health agenda. Hopefully I'm reading this the last time, but pursuant to the governor's March 12, 2020 order, suspending certain provisions of the open meeting law, general law, chapter 30A, section 18. This meeting is being held via remote participation to the greatest extent possible. Every effort is being made to ensure that any member of the public may access the meeting in real time via technological means. Agendas will be amended to show the link and participation code to access the meeting no sooner than 48 hours. Recordings and/or draft proceedings of the meeting will be available on our website as soon as possible. If there's any, Mr. Chair, if there's any motions to make decisions, we've just got to do a roll call vote. Floor is yours.
Okay, thank you. So anyway, that's good. I'm very happy that we've got this Zoom thing. I hope we continue it in the future, even if it's not absolutely necessary, because it helps with the recording and everything. So we have a quorum today. All the members are present. I'd like to have them. Has everybody had a chance to review the minutes?
Yes.
Is there a motion to make any amendments or to approve them? You want to make a motion to approve them, anybody?
I'll make a motion to approve.
Okay, second.
Yes.
Okay, all in favor? Aye.
Aye.
Aye. All right, now, so those are the, let's see, the next item is we have a warrant item for mosquito control to recommend to the town that the town withdraw from the mosquito control for a number of reasons, which we actually initiated this as a board. And then there was a little bit of confusion that came up as a result of a misunderstanding, I think, by our town council. Jim, you can step in if I'm misunderstanding this, but I think our town council thought that a state, a regulation about the aerial spraying was going to preclude what we had originally recommended to the select board to put on the warrant vis-a-vis the local spraying. And so for a while, there was a little confusion about that, but I think that has been fully straightened out, and town council understands what the dichotomy is. In other words, that we don't deal with aerial spraying from planes. We just look at the local things such as pellets, larvicidal things, and local spraying. Jim, is that the way you understood the confusion to be?
Yeah, there's two different processes that happens. There's the local program that Stockbridge is a part of. There's a process to join and withdraw. And then what had happened is a couple months ago, the Department of Labor Standards sent out a blast email about how to opt out of spraying. And I think a lot of people got confused about that. That's a process where mainly on the eastern part of the state where West Nile virus and Triple E are very prevalent, the state can actually make a decision to aerial spray large geographic areas. And this opt-out process allows a municipality to opt out. But in order to opt out, you have to demonstrate a comprehensive plan. So, there's just a lot of confusion, but I think we're back on track moving towards town meeting on what Stockbridge is attempting to do.
Okay, so that more complicated process that you just described doesn't obtain with respect to the town of Stockbridge.
No.
And so I just wanted to get it, make sure that everybody understood that. Does anybody feel that we need to make a formal reaffirmation of our support for the warrant item, or should we just let it go the way it is since if everybody knows? I'll leave it up to you to decide. Hank?
I think it'd be a good idea to make a formal reaffirmation.
Okay, would you like to make a motion that we formally reaffirm it then?
I make a motion that we formally reaffirm our warrant article to cease using the Berkshire mosquito control project for Stockbridge, for the town of Stockbridge.
Any discussion, more discussion? Second for the motion?
I second.
All right, all in favor? You want to do a roll call vote, Jim? Is that how we'll do it?
Please.
Ray, do you want to start? Yes or no?
Yes.
Hank?
Yes.
And I'm yes also, so we have it unanimous. So the next item on the agenda is, again, a warrant item. This is one that I suggested that we formally review and consider supporting. I'd like it's about the Stockbridge Bowl Stewardship Committee, and I constantly put in this surveillance error.
Yeah. We noticed that, Charlie, yes.
It started out with the cyanobacterial blooms, and and I was interested in getting a testing program in place to be surveillance. So fortunately, our select board, Roxanne McCaffrey, pushed it forward, has brought this to a new level where we've actually had a committee of a lot of different stakeholders, including the Board of Health, participating in discussions which have ultimately culminated in having a very good testing program in place, and also having getting a plan for lake management. So I think that, and now there is a warrant item that says that this committee should be moved up to a new level, a permanence in the town as a commission. Now, the committee was originally formed by and totally directed by and controlled by the select board. This would continue to be the way the commission would be put in place, but the difference would be very significant, I think. First of all, if it were moved from a committee to a commission, it would get a budget so that it could do certain things on its own and handle things. And secondly, we'd be able to actually get a secretary to do the minutes. Up till now, we've been sort of picking who does the minutes from session to session, which sometimes becomes a little confusing. And secretaries, of course, have other functions for handling information that's valuable for the members of the committee. So that I think this is going to be a big improvement. So I would like to make a motion that our Board of Health formally support the idea of having the Stockbridge Bowl Stewardship Committee change from being a committee to being a town commission.
I'd just like to point out that this is the first time, at least in my memory, that the town of Stockbridge has really taking over, looking at what's going on with the bowl and looking at surveillance and the health of the bowl. I think it's a great thing that they're doing, and I support your motion.
Thank you, Hank. Ray, do you have anything to say about that?
No, I concur. I agree, and I second.
Okay, so let us have a roll call vote then. Ray, would you vote in favor or against my motion?
In favor.
And Hank?
Yes, I'm in favor.
And I'm also, so we have another unanimous vote in support of that. Now, the next item on the agenda is this is something that I wanted to put on the agenda because the governor, of course, and throughout the country, we're seeing a backing off from the restrictions about the coronavirus. This is coming to pass because we're getting penetration of vaccinated people. The vaccine is working. It helps a lot of people, and ultimately it will slow the disease down. We're already seeing evidence of that in the sector that has been vaccinated. Now, on the other hand, the sector that hasn't been vaccinated is showing a case rate that's very similar to the way the entire population was behaving several months ago. So, and in fact, in some states, the unvaccinated people are becoming the rate of case transmission is very high, so that these unvaccinated people are going through the epidemic stages just as though they weren't vaccinated, which they're not. Now, the reason that I think we need to look at this is that the governor will be lifting all the restrictions for the state pretty soon. I think that's taking place over Labor Day. Is that right, Jim?
No, Saturday.
Saturday.
Okay, so
29th, right?
weekend.
Yeah.
Is that Labor Day weekend this coming weekend?
It's
Memorial
this
Day.
Saturday.
Yeah.
Memorial Day, sorry, Labor Day. I'm saying Memorial Day. Pardon me. So the idea is this is coming up pretty fast. What I think we need to think about from the Board of Health point of view is the following. First of all, we've been very successful in maintaining a healthy environment for the people in our town by the restrictions that we've had in place through regulations, and in addition through the state regulations, and in addition to that through voluntary steps that were taken by various sectors in town. For example, I'm sure you remember the Marian Fathers stepped up. They had a very large convocation planned in the spring. And even before the regulations to limit congregations of people were put into place by the governor, the Marian Fathers voluntarily, based on understanding how the disease could possibly spread, they backed off from having that big celebration and really helped the town out, I think, a lot by doing that. It was a sacrifice for them, but they did a good job with that. Now, at the present time, if we think about the vaccinated people only, there's really very little reason to have restrictions for vaccinated people. Vaccinated people are pretty well protected from the disease. But unvaccinated people are, as I said, very vulnerable to the disease and are showing a continually increasing vulnerability. The problem is that unvaccinated people are not simply people who choose not to be vaccinated. If it were just people making their own decision about it and going about their business and assuming that they could get sick and be fine, that would be one thing. But we have people who are, for example, very young children who are susceptible to the disease. And we have people who have been treated for various kinds of problems that have depressed their immune system's response so that they're vulnerable to a disease like coronavirus. And I think it's incumbent on us to keep in mind the fact that even if we just think about relatively healthy, unvaccinated people getting sick, and correct me if I'm wrong here, Jim, if we simply lift all restrictions, and if a group of people come to town who have not been vaccinated and get sick, that's going to impose a burden on Tri-Town and even also on other towns in terms of case tracing. Is that right?
Yes, and it would cripple the department. We wouldn't be able to respond to that.
So the idea here is that what I'm saying is I think the governor may be very right in just lifting all the restrictions. It may turn out to be fine, but I'd like to take a little bit of an extra precaution about that and recommend that rather than just opening up the town 100%, considering these other vulnerable people who are unvaccinated, considering the burden on Tri-Town that is going to be imposed by a large case rate, I'm going to make a recommendation that we only increase to increase the size of crowds that we permit in Stockbridge to one that's pretty safe for Tri-Town to manage in terms of case follow-up and things like that. Jim, what would you say that number should be?
So what we're talking about is outdoor large capacity venues. And so the number we were thinking about is not to exceed 9,000 at any given event. And how we derived with that number is the town of Stockbridge has a current bylaw that at any given event cannot exceed 18,000. And so right now it's at 25% capacity. So if we were for example, BSO, if they were going to do a function right now without the current governor's restrictions, it would be around 4,500. That'd be 25%. So if we incrementally just don't go past 50%, that's where that 9,000 came from. And so I know I did draft a draft regulation in hopes to look at this. And so what it would be is if we can get consensus from the Stockbridge Board of Health. I just came off a Lennox Board of Health meeting, and they made a motion to move this draft to a public hearing, hopefully jointly with Stockbridge, should Stockbridge decide to do that. And so, we're looking at maybe just limiting these outdoor large capacity gatherings to September 1st to give us more time to acclimate the other sectors for reopening and just take our time reopening, because going from 25% to 100% like overnight, it is a concern.
Jim, do you have a copy of that draft regulation?
I do. If you just
Yeah.
bear with me.
Yeah.
I think this is it. So this is what I took the liberty of, putting some thoughts and ideas together and running them by town council. And so basically what we would have to do is if the board is interested, we would want to have a motion to move to a public hearing, and hopefully we could do it jointly with Lennox and just do one process. I would still have to comply with the open meeting posting, get something in the paper. But basically what we're looking at is, if you can see
Right
my
there.
screen,
Yeah.
you can see right here, I'm going to highlight it in yellow. This is really the most important piece. It's really all venues with a capacity of 9,000 or greater, whether indoor or outdoor, are prohibited from exceeding 9,000 for any one event, not including staff, performers, and things. And I think putting a cap at 50%, because the majority of some of these venues are in Stockbridge, by the way. And we also heard that Kripalu is going to slowly reopen to August, and they're doing the right thing, is slowly ramping things up. Because I think most of us understand that going from first gear to fifth gear overnight is a concern. And so, and we were hoping to maybe just extend this until September 1st. And I think, we have to comply with posting state laws and open meeting laws, but I want to remind the board that these restrictions, current restrictions are lifted this weekend. So we would want to try to navigate this, if the board wants to do that, kind of quickly, but still compliant with all the applicable laws.
Jim, do you know what Tanglewood's plans are in terms of crowd size, or what they were planning?
Well, I mean, I was working with them, and they submitted plans based on current COVID restrictions.
Okay.
And, while I haven't talked to them directly, and I know Smitty's on this call as well, is I did have some conversations with them, and there seems to be consensus on, I think going to 100% capacity is probably not a good idea. Not only from a COVID perspective and a tri-town response perspective, while this is anecdotal what I'm about to say, but I think a lot of restaurants and businesses, including these large venues, are going to have a hard time ramping up staff, because I think a lot of people are still out, and I think it's going to take some time to ramp up staffing. And I know if Smitty has anything to say, I know he's had some conversations too, and he reached out to me a couple of weeks ago, asked me what our thoughts were on this. And Smitty, are you still on the call?
Yeah. Thank you very much, Jim, and thank you to the Stockbridge board. I'll just weigh in quickly. And I told this to the Lennox board. I think we were all surprised. Everybody was planning for August 1st. So Tanglewood, for an example, they weren't having any popular artists like in June that they normally would have. They were doing everything later in the year. They were going to have the orchestra only, not even the choral group. They didn't want to have any vocalists. So I think when the governor made it May 29th, it kind of caught everybody by surprise. Tanglewood is not concerned about what you guys are proposing. I think they'd be very supportive of it, because it actually only affects probably 2 or 3 dates that they would have. On a normal Friday, Saturday, or Sunday afternoon BSO, they attract 5, 6, or 6,500 people anyway. So if you settled in at 9,000, it's not going to impact them whatsoever. I think they'd actually would feel much more comfortable because the Band-Aid's been ripped off. And they, like a lot of businesses, and Dr. Kinney has been very helpful in our conversations, talking about the Marian Fathers as another large outdoor venue as well. The capacity to serve these folks is restricted this summer. I think the public health concerns that we should all proceed cautiously, in my opinion. And I would even argue a public safety issue. If we don't have the young people parking cars in the Tanglewood parking lot, and God forbid something happened, there could be chaos trying to get public safety vehicles in and out of there. So I think Tanglewood will be very supportive of your initiative here. And I don't think you're going to have any backlash whatsoever.
Thanks.
So now, Jim, when would you or let me ask the rest of the board. Ray, do you have anything else to say about this, or do you have something to say?
No, I think going on the timeline with Lennox would be good to sort of get this all out at the same time. So I agree with Jim on that.
Would you both want to have a hearing with the Lennox board? A joint?
Yes, I think that'd be a great idea.
Okay,
I
so
second. Yeah.
can we have a motion then from one of you that we would like to join the Lennox board in an official hearing to discuss this, and in particular the draft regulations that Jim has just brought forward to us?
I will make a motion for that.
Okay, a second?
Second,
Okay, all in favor? Ray?
Aye.
Hank?
aye.
Okay, and I'm in favor too. So Jim, when did you reach a date for this hearing?
Sort of. I'm gonna throw to the three of you some dates that Lennox was thinking about. So I need at least 5 to 6 days to post and get something in the paper in short order. I was thinking June 3rd, which is next Thursday, or Friday between 9:30 and 11. Thursday or Friday of next week.
Okay, can we have like a day to look at our schedules and figure everything out?
Sure. Yeah. I'll shoot off. I'll email you individually to get consensus and.
I'm
I-
off on June 3rd. I work June 4th. So
Okay,
I might have a
Yes,
baby, but
Jim, if you'll send out those dates, and then if you guys get back to me with it, I'll coordinate it.
okay.
And Jim, you're also going to owe us a copy of that draft regulation so we can all look at it.
Yeah.
He emailed it.
Okay, oh, you already sent it. Good, you're fast.
Yeah.
Okay, all right, so I think we've covered this agenda item, haven't we? That we're all set then?
Yeah,
Absolutely.
I'll send out a separate email.
Where's the volume?
I'm just gonna ask that if you can get back to
Is
me
there-
like ASAP. The goal would be to get the public notice in the paper by the weekend. So if you can just get back to me, I'll do that tonight.
Can you help me? I don't know how this is.
Somebody asking
Uh,
the audience there? No? I thought I saw somebody ask. Okay, so does anybody have any questions at all about this? Can we move along to the next agenda item?
Yes.
Okay. The next agenda item are the Tri-Town updates, particularly the nursing that Jim has been working on, the nursing piece.
Sure, yes. So if the board knows, we've been working on a very comprehensive draft application submitted to the state. They put on an RFR to expand shared services to really start building capacity for boards of health. So, and we were discussing as a Tri-Town district, as you know, I think we responded well to the pandemic. We have had significant gaps and challenges without having any public health nursing program. And that was, we were having those conversations before the pandemic, and the pandemic really highlighted that. So the state finally, you know, one of the silver linings coming out of the pandemic is the need to bring additional resources to boards of health to really start recruiting for the next generation of delivering public health. And so the governor has made a significant contribution to annual funding of local boards of health. And so what we did is we looked kind of closely on what the needs of Southern Berkshire would be. And so we partnered with several South County towns, and we came together as a coalition to put an application in to create a Southern Berkshire public health nursing program. And so that was submitted. We've been awarded a significant grant, the largest that we've ever seen, almost $4 million. I just executed the contract the other day. Ray has been part of multiple nurse interviews, so thank you, Ray, for participating in that. And we're moving forward to hiring multiple nurses at the cost of the state. You know, there's going to be town costs associated, you know, outside of that for, you know, other ancillary items. But I'm proud to say that we're going to be building something very innovative, exciting. And I think, you know, we're going to be looking at a lot of things coming down the pike. And so that's going really well. It's going to be new, working with some of these smaller towns, But I think Tri-Town and our 94+ year leadership of being the oldest health district, we bring a lot to the table to mentor, to assist, to help these smaller towns, and just to really to deliver comprehensive public health nursing to our constituents, to close the gap on health inequities and to improve health outcomes. We've never offered comprehensive public health nursing because we can't afford it on the backs of the taxpayer. So building capacity at the local level with state support is going to be something that can't go away anytime soon. And so I'm like really excited about
And we're
that.
very fortunate to have hired the nurse we did for the first position, because she's great, right, Jim?
Yeah, I'll be making a formal announcement on that to the group relatively soon. But yeah,
Okay.
she brings a
lot to the table.
significant
Yeah.
a level of experience to the table, and we're really excited to begin creating a new system. We'll be setting priorities and we'll be thinking about that as we move along, but there's going to be a lot of things we're going to be doing, and it's really exciting to do. So thank you, Ray, and many others for participating in this huge endeavor that we're undertaking.
Very exciting.
Congratulations, Ray and Jim. Okay, I think this is a really big step for Tri-Town, and it's gonna involve a lot of other towns too. And that always leads to collegiality, and it's nice to interact with other towns. So I'm very happy about that. So thank you both for doing that. It really stands well for the board. It reflects on the board, and of course Hank and I will take credit for it.
Sure.
Okay, so I think we've covered the agenda items. All I would like you guys to do is if you can be thinking a little bit about the next meeting and the next agenda items. Of course, the office is going to be one thing. We're going to be moving out of the coronavirus into a new era. And I want you guys to be thinking about what things we ought to be thinking about there. And have we learned anything from this? Have we some other ways that we could be setting things up for the towns? It might be easier the next time. And also, I'm of the mindset that we personally on the Board of Health were helped a lot by the cooperation of people in town. There were different groups. I mentioned the Marian Fathers, the First Congregational Church was really stepped up. I mean, there were so many different groups that held this, the ambulance, and we wouldn't have been able to have what happened happen if.
Are we not doing the unit council meeting, or we don't know where?
So I'd like to sort of think about how we can repay them or do something for them.
I'm gonna tell them I'm gonna leave the meeting.
I think we just got a lot of support from the town that was.
Charlie, I'm gonna have to leave the meeting now.
Well, that's good, because we're all gonna leave the meeting. I hope that this is the meeting.
You remember Charlie.
Have a good day, everybody.
Thank you.
A
Thank
motion
you.
to adjourn?
Motion to adjourn.
Okay.
Second, aye,
Okay, end of the meeting. Good.
bye.